So today we want to talk about a topic which is a little bit confusing for most students, which is distinguishing between upper motor neuron facial nerve palsy and then lower motor neuron facial nerve palsy. So let's look at it. So this is the brain, this one half of the brain, this another half of the brain. Okay, this is the brain stem, this is the midbrain, this is the pons, this is the medulla. So now the nerve in question is the facial nerve. Anatomically, the facial nerve arises from the pontomedullary junction. However, the facial nuclei is found within the pons. So these structures you see here is the facial nuclei. Now the facial nuclei has two main parts, the ventral part and the dorsal part. The ventral part and the dorsal part. The ventral part innervates the upper part of the face, and then the dorsal part innervates the lower part of the face. Now pay attention. The ventral part, okay, receives cortical input from both ipsilateral and then contralateral side. The ventral part receives cortical input from both ipsilateral and then contralateral side. However, the dorsal part receives cortical input from only the contralateral side. So when we say upper motor neuron lesion, what do we mean? What is the reference? The reference point is the level of the pons, where we can find the facial nuclei. So any lesion above the level of the pons is upper motor neuron lesion. So this is where the damage is. So once the damage is here, we can trace the fibers. See, it's coming down to the dorsal nuclei, which supplies the lower part of the face. So there's paralysis. This is the lower half of the face. We can also trace the other one going to the ventral nuclei, going to the upper part of the face. Now the question is, why is it that in upper motor neuron lesion, there's only damage or paralysis to the lower half of the face, and then the frontalis muscle or the forehead muscle is spared? It is simply because for the ventral nuclei, it has ipsilateral innervation and contralateral innervation. So in this case, the upper motor neuron lesion, okay, it's only the contralateral side that's affected. The ipsilateral is intact. Okay, that is why the forehead muscle is spared. So in upper motor neuron lesion, the frontalis muscle or the forehead muscle is spared. The damage or the paralysis is on the lower half of the face. Now let's look at the lower motor neuron lesion. Now the lesion or the damage is below the level of the pons. So you see, once the damage is here, you trace the fiber. This is going to the lower part of the face. There's the damage here. This one is supplying the upper part of the face. So the damage is on the lower half, the half of the face. So for lower motor neuron lesion, the paralysis is on one half of the face, the other half is intact. But for upper motor neuron lesion, the paralysis is on the lower half of the face,